have you join us today on the program Healthy Living on ITV. I am ASTHMA Osa. Sometimes when you see people breathing very hard, they cannot breathe properly. And then other times you see their eyes popping out with tears. So you just wonder what is wrong with this person. What could be the problem? And many times you see some other persons, they will be losing weight without even trying to lose weight. And they may not just know what is happening with them. This is why you just have to go to the hospital. We advocate, we preach to people, we urge you to always go to the hospital so that you will know exactly what is wrong with you. You cannot self-medicate. And the condition with A is not usually the same with B, even if they manifest the same symptoms. So you must be very careful what you do. So today we want to look at asthma. What is asthma? How is it diagnosed? What is it like? What are the symptoms? How do you know that you have asthma? Do you even know what is wrong with you? Just because one person is manifesting some kind of signs, and then it is assumed that the person has asthma, and then you will think, because you are manifesting almost all the same signs, that means you also have asthma. How wrong you could be. Until you go to the hospital, you may not know. So join me as I welcome Dr. Godfrey Nodiana is a senior registrar in internal medicine at the University of Benin. It's nice to have you, doctor.
Pleasure being here.
Okay. All right, doctor, we're looking at asthma. What is asthma? What exactly is asthma?
Well, simply put, asthma is a chronic inflammatory lung disease.
Okay.
It's a lung disease it's a disease that affects the lungs, the bronchioles of the alveoli, and makes somebody not to be able to breathe well.
Okay.
And where there are constellations, there are several definitions that you can give to asthma. However, the precise one is to know that it's a chronic lung disease that can affect the respiratory system and prevent somebody from having a good regular breathing.
Okay. All right, you just heard Dr. Nodiana. It can prevent somebody from having good and regular breathing. When you have that kind of problem, where do you run to the hospital? So, doctor, how is it diagnosed? How do you know?
Well, asthma generally is diagnosed, it's a clinical diagnosis. Patient could have a complaint that he or she, or maybe for the past few days, they have been noticing chest tightness, coughing at night, cough that is worse at night, or not being able to breathe well. Then he or she may complain to a health expert or somebody who have the information about asthma. It could be a self-diagnosis, but it's a clinical diagnosis the doctor can make with a support from some investigatory, from some laboratory investigations where you can now support your diagnosis. But clinically, it comes from signs and symptoms and from examinations. Okay. Somebody that have asthma will be wheezing. And when we say wheezing, we're talking about like a musical instrument where somebody make an abnormal sound different from the way the breathing or the system used to be. And the person will notice that something is wrong. So when the doctor listens with the aid of the stethoscope, he or she will now know that this person is having an asthma and probably decide to go further by doing some investigation like this, what we call spirometry or the lung function test. Then by the time that those instruments are used to measure how the person is able to take in air and breathe out, then a diagnosis can be made. But simply put, it's a clinical diagnosis that the patient or the doctor will be able to make.
All right, there are a lot of persons who do not like to go to hospitals. Even if they know that they are dying, they don't want to go to the hospitals. I don't know the phobia for hospital, what it's called, and why they don't like hospitals. So how would somebody, such a person, know that he or she is having asthma?
Well, generally, people have,
the ones that you've just told
from a part of our environment, whenever you decide to go to the hospital, you need to spend money. And because you need to spend money, you consider that like a luxury. But head, they say, is wealth.
It's wealth.
And there are certain things you may not know that you will get to know by going to the hospital. And one may think that you just have an asthma, but there could be other systemic illnesses that will accompany the asthma. So by going to the hospital, that will avail the person the opportunity, to get some disease diagnosed early enough so that it can be managed accordingly. But for asthma, generally, when somebody have an asthma, because it affects the respiratory system, and once somebody cannot breathe, most time people present to the hospital in an emergency situation because it is not leg pain or headache or something that you can bear is something that will have to affect your airway. The patient is unable to breathe at that time.
Okay, is asthma something that comes suddenly on the person?
Yes, the attack can come suddenly.
Even when you breathe normally?
Yes,
before.
somebody, maybe a non-asthmatic or somebody who have never been told they have an asthma, all of a sudden after doing one or two things or being exposed to the triggering factors, or maybe there was an exercise, the person did an exercise which can trigger the asthma that was actually in a dormant form, and suddenly the person noticed that he or she cannot breathe, and now showing that wheezing sign. So people close by will know that this man cannot breathe, and look at the kind of sound he's making. At that time, it is important for them to take them to the hospital. So most parts of the world, or part of our developing society, in this Nigeria, you find out that asthmatic patient comes to the hospital because it will become an emergency, compared to a developed society where people go on regular medical checkup, and probably by the time you ask them to do maybe a routine spirometry, and the person, you are able to diagnose, the doctor now look at the values, and know this person may have a mild, moderate, or severe. At that time, it will not be an medical emergency. But most patients that come to the medical emergency, they come, in an emergency situation. It could be a previous asthmatic, or just recently diagnosed, or maybe for the very first time. So it is important for us to understand what is wrong with us, so that we will not fall a victim, because it can happen where somebody will be in 500 miles away from the hospital. That is why it is important for you to do a regular checkup. At that time, there may not be an hospital that will be able to give a first aid treatment to this patient, and that could be very fatal. So asthma can present in the first time in a fetal condition, very serious condition, that could even kill the patient before the diagnosis is even reached.
If you don't have it before.
Yes, before the diagnosis is even reached, the patient can just be said that he or she was unable to breathe, was just breathing up, they could describe it for you. And when you find out that the person actually had an asthma that was not detected, and of a sudden, the patient is gone. That's that.
Well, in the course of researching on this topic, I came across something called viral-induced asthma. Then another one as intermittent asthma. I'd like you to explain this to me. Viral-induced asthma. What is
well,
this?
It's just when you can ask somebody, okay, what's the cause of asthma? Many things could cause it.
Okay.
So when they're telling you that there are some respiratory syncytial virus, or there are some respiratory viruses that affect the airway, these could be the reasons why this patient have an asthma.
How do those viruses come to
Yes, just like every normal person have an infection. Could be bacteria, fungi, or whatever. So also you could pick up the virus from the air or from wherever you contact with somebody who have this kind of infection. Okay, so this infection will now predispose this patient to have an asthma. Maybe there's already an dormant asthma, but having this respiratory infection, you understand, somebody have an asthma that is probably not on medication, and now developed this viral illness. So that will now predispose or exacerbate this asthma that was in a dormant form, now make the symptoms to be worse at that point in time. Then when we say intermittent, just it's like an English word, something that come up, come up now, the person will go, just often and on is coming. That's just the way it is. But there are various types or causes what can result to an asthma. Somebody could have an asthma who was, maybe when she was not pregnant, the asthma was not there. All of a sudden, now that she's pregnant, asthma will just come up. So that is unlikely, pregnancy-induced asthma. And this patient have an asthma before, but he or she doesn't even know that she has an asthma. All of a sudden, in this pregnancy, she now started developing the symptoms and signs of asthma. They will now tell the person, you have an asthma. The patient will be so surprised. Oh, I never had an asthma from my childhood, but now look at what they are telling me. Yes, asthma can come at any age of one's life, and so it's important for us to do a routine medical checkup. So
okay, let's have an overview of the causes of asthma.
Wow. Asthma is, one cannot pinpoint, say, oh, this is the real cause of an asthma. But from what the literature have it, there is a genetic causes and there's environmental causes. Okay. And when we mean by genetic causes, we are talking about a gene that one can inherit from a parent or both parents, hereditary. Okay, a situation whereby you see an asthmatic, most time we take an history from that patient. We want to find out whether he or she is aware, whether the father or the mother or any person from the family, have an asthma. So if somebody will tell you, oh, my auntie, my paternal or my maternal auntie, so there is a hereditary pathway of an asthma, which is the genetic aspect of it, and there's environmental conditions that can also predispose one to having an asthma. Somebody who is a smoker could come down with asthma. Somebody who is a second-hand smoker, the person does not smoke, but he or she lives close to those who smoke. Somebody, yes, somebody who is exposed in his workplace to some chemicals, they say occupational asthma. Somebody who, exposed to those kind of chemicals, they now started developing signs and symptoms. Or the asthma will become worse when that person, goes to the work environment. When the person is at home at a point A, there is no asthmatic symptom. By the time he or she goes to her place of work, is now having signs and symptoms of asthma. Asthma coming from different exposure to allergens. So all this will come together and give the patient what an asthma. So in a broad way, genetic and environmental, they are the ones that predispose. Under these subheadings, we'll now talk about the other types of asthma.
Okay, now let's look at asthma and cough. Are they related in any way?
Yes, cough is one of the symptoms of asthma.
Okay.
But some people may have an asthma and not have cough.
Okay.
Some may just have asthma. We call it cough variant asthma. The only symptoms of this patient is that he or she is coughing at night, and this cough will qualify it by saying it's usually worse at night. Worse at night because the airway there may be some irritation that will happen at night when the person he or she is sleeping. At that time, the cough will be worse. So there are asthma that are cough related, and there are asthma that are not cough related. So cough is one of the signs, it's one of the symptoms a patient will present with asthma and tell you, doctor, at a particular time of the night, my cough is worse. And this cough will be different from maybe other respiratory disease, because asthma also have differentials. If it is not asthma, it could be other things that is affecting the airway. So, but this cough, when a doctor look at this patient, take a good history and examination, you find out that the cough is worse at night. It's not like the kind of cough you see in TB. It may not be having hemoptysis, when you have cough with blood, and the cough may not be productive of sputum, but it's just a dry cough, distressing, worse, and prevent the patient from sleeping. And once it is this morning, maybe 9 o'clock, 10 o'clock, the cough is not there. But at a particular time of the night, I'm unable to sleep. That's when I have this cough. So one will say this is a variant, cough variant asthma.
Okay, so this cough, how long should somebody have it before you start running to a doctor?
Well, once somebody have a cough that is not...
some of us are used to, let me just run across the road and buy drugs.
It's possible.
And kill this cough.
Yes, when you have a cough, when somebody have a cough that is not within 4 or 5 days, going to 1 week or 2, and the cough persists, there are other things that could be there. It may not be asthma. Like I said, asthmatic cough is different from the other respiratory disease cough. But once you have a cough that is now affecting the chest of the patient, is unable to breathe, a kind of a cessation of breathing, the person is unable to breathe down, and there's maybe a chest pain associated with it, you should be thinking of, and for asthma, you will not have it the way you have it in TB, where the person will be losing weight, probably, having a drenching eye sweat, having fever. A healthy patient having cough that is dry and worse at night, that's an asthma. So whenever there is a cough that is not relieved with maybe medications, ordinarily majority of people crosses.
And this cough is just only in the night? Yes,
worse at night, early hours of the morning, and somebody crosses the road, buy antibiotics, 2-3 days the cough is still there, and now it's not affecting the respiratory system. It's unable to breathe well. It will be important for you to present at the hospital so that various investigations can be done to know if this is asthma or if this is other respiratory diseases that are not asthma, so that one can differentiate them and give a right appropriate medication on time. Okay, now you did mention that asthma is something that can be inherited from parents. So when children are born with it, how do you diagnose it that this child is asthmatic? Most time, like I said, asthma is a clinical diagnosis. Yes, you said so. We're looking at children now. Yes, a man could be asthmatic, the wife will be asthmatic. They will have children who will never manifest the signs and symptoms of asthma in their lifetime. Okay. While some other persons, the father is not even asthmatic, the mother is not asthmatic. Maybe one paternal or maternal uncle or auntie have an asthma. They may not even be aware that they have this asthma. Now, diagnosis is clinical because there must be the signs and symptoms. Once a child is unable to breathe well, having cough that is distressing, chest tightness, and now have a cough history of like 4 to 5 days that is not even productive of massive or any sputum, then a doctor now examine that child by using the stethoscope. He will be able to pick up a sound. Once you pick up that sound, then he can qualify to be an asthma. Then if you want to go further, you now go and do some other investigation, which the patient will be asked to do. But most of the asthmatic that we see that occur between the ages of maybe 4 to 12, they are usually genetic.
Okay.
But that does not mean
4 to 12.
Yeah, 4 to 12. I mean, within less than 12, let me just say less than 12 years of age, they are usually related with genetic. But above 12, then it can be environmental induced.
Is it possible to outgrow asthma?
Literature said yes. Some people outgrow asthma, meaning that somebody have an asthma when he was 10 years, and he became symptom free. Most time you find out that as soon as they grow older, they may still manifest the symptoms of asthma. Yes, it's possible to outgrow asthma. People have had that asthma when they were young, childhood asthma, and they never manifest the symptom again. But it is vice versa. It could happen in the future that asthma that the one had when he was 12 and now having it again when he was 46, when he's now 46. One could also agree that yes, when he was in a child and he had an asthma, and today he's 70, he never had that symptoms again. It's possible. It is in medicine nothing that is not possible, nothing that is there that is impossible. But when somebody have an asthma in childhood, it's important to monitor that patient, because at any point in time, if he or she is exposed to that same triggers that made asthma to come when he was young, it could also now present with that signs and symptoms of asthma. Okay,
in a moment we'll be talking about the trigger factors. All right, just joining us, the program is Healthy Living on ITV. You can call us on 052-290-573. 052-290-573 is the call line, and there's another number on the screen there. So give us a call. Ask the doctor a question. You might just be having this problem and don't know what to do. Some people know what to do, which is going to the hospital, but they would never want to take that risk of going to the hospital. I don't know why. Maybe doctor will tell us why people are scared of going to the hospital, but that's your best option anyway. So give us a call. Ask Dr. Inodiana a question, relating to this topic, please, so that he will be able to give you an answer and you will be happy and better off. Now, doctor, let us look at the trigger factor of asthma in adults and then children. Let's take the adult first.
I said that it is possible to see an adult onset asthma. Now, we said it could be genetic and it could be environmental. Then we also said that it could also have an asthma, pregnancy-induced asthma, exercise-induced, premenstrual pain, so many. And so somebody who have the gene or who have that tendency to develop asthma, and he or she now go to a particular environment, chemical environment to work, then he or she will start manifesting the signs and symptoms of asthma. So what are these trigger factors? There are so many trigger factors that can trigger an asthma. An asthmatic may not even know that he or she is asthmatic until some exercise is done, or the person is just running and decided that he cannot breathe well again. So exercise can induce asthma. The animal playing with pets at home, most especially the poultry pets, the poultry, the birds. Then you can also have some other cats. The dander of this animal could be carry the pollens of this trigger. Okay. So this could affect this patient. Okay, let's quickly take this call before we continue. Hello, caller. Good afternoon. All right, we lost that call. Please call us again. All right, doctor. Now, you could also be exposed to some medications. Somebody who is hypertensive taking a particular medication could be exposed to asthma. Somebody who has body pain taking aspirin, there are aspirin-induced asthma. Okay. So drugs. Let's do this call. Hello.
Hello.
Yeah. Good afternoon.
Good afternoon, ma'am.
Please tell us your name and ask your question.
My name is Joy Ete.
Okay.
At the year of the way doctor talk about asthma, if I cough, my breathing the guy is really mostly for the perceive the hair or for the tongue. Because when I say my breathing, they carry my breathing up.
Okay.
So then, so I don't go to heart and X-ray. They say nothing to my heart.
Okay.
So the asthma. But since December now, I dey cough. The cough no green go. I don't treat her with many drugs. It no green.
Okay, Dr. Nodiana.
Just like we said, once you have symptoms that persist more than the number of days that you are not supposed to, the next thing to do is to go to the hospital and see a doctor. She has done the chest X-ray that said, that's why I said that to diagnose an asthma, there is no specific investigation you will do. It is mostly going to be a clinical diagnosis, but supportive with the investigations she had just mentioned, the chest X-ray, the lung function test, and some other ancillary investigations. So it is important for her to come to the hospital, see a doctor who will examine her, because the chest of an asthmatic, once you examine as a doctor, put your stethoscope and look at that and examine this chest, you'll be able to pick up one or two abnormal sounds, different from a normal patient. Then you now have to tie up your diagnosis. It's also possible that you also examine this patient and not find anything at all. But because of the symptoms and signs, then you can now say, okay, you try a drug of an asthmatic drugs, and the patient will just tell you, I'm now free from that symptoms. So a doctor or a health professional is the one that can advise, patient very well on how to go about treating any cough that is persisting more than 2 weeks.
Okay, we'll take this call now. Hello. Okay, we're missing so much calls. Just take your time and give us a call. All right, Doc, while we're waiting for calls, let's look at treatment. How do you treat asthma without mentioning the names of drugs? Hello, caller. Hello? Okay, the network is jamming this afternoon. Don't worry, just keep trying. Okay, doctor.
Now, talking about, for you to start treating somebody that have an asthma, you need to educate them. Okay. Especially on this part of the world where people don't want to come to the hospital and where diagnosis sometimes is not being accepted by patient. So when you say somebody have an asthma, he or she will say, no, I don't have an asthma. It's not my portion. So now for you to start treatment, which you will use medication, you need to educate them very well. What is this asthma? You let them know how the asthma came and what is supposed to be done by them. And once they play their part, you find out that you have everything will be very easy. First, it's important to say that asthma does not have a cure.
So it's not
curable. It's not curable. What we can do about asthma is to control it. Controlling asthma means that one have accepted the diagnosis that he or she is asthmatic, and that this asthma does not, it will not kill, it will not be filtered if I do my own best by taking my medication and yield it to the advice. So once you finish with education, which will involve avoiding the trigger factors. Somebody have an asthma, he or she have poultry around the house, or you live in an environment where they rear, birds. You know that if these birds will trigger your asthma, it is better for that patient to relocate to an environment that is safe.
That is free.
So you have pets at home, that we are not supposed to have this kind of animals around you.
What kind of pets?
We have just said that.
Is this any pet?
Yes,
or particular
some pets are known to trigger asthma because of the dander, like I have said. So once you have an asthmatic, it's important to just avoid pets if it's possible.
Every pet? Yes,
because you may not know the one that will be able to, the one that will the one that might carry the triggering factor, so that you don't now play into the hands of this asthma. So you just avoid everything that will trigger the asthma. So once you avoid the trigger factor, somebody have an asthma, maybe you go to an environment where there is overcrowded, you're not supposed to be there, then you need to avoid that. And how do you avoid that? Not that you don't just go to a crowd, when you are there, probably you have your medication. You are aware that I'm asthmatic and I'm supposed not to spend more time here. Yes. In a dusty environment, you have a room that is not well cleaned, not well ventilated, there are cockroaches are there. These are not just good at all. Or you have some chemicals around your house that you ought to avoid. Somebody is smoking around you, or you are a second-hand smoker around your window in your bed where you sleep. There is somebody that smokes, very close to you. You have to avoid all this. By the time you are able to avoid this trigger factor, and the patient is on medication, you find out that the patient will not come down with an asthmatic attack. Compared to somebody who decides not to yield to this advice, he or she is asthmatic, still smoking, or a second-hand smoker, the environment is not clean, the bed sheet is not. For asthmatic patients, we tell them in the hospital to make sure they clean their room, to ensure that their room is very airy, and their room is not, they dust their wardrobe, ensure that there is nothing that will make the environment, congested. Once they are able to avoid this all these factors, you find out that the patient's symptoms will not persist. It will just be so mild and controlled that he or she will just be on medication. But once you are still taking medication and these factors are still there, it will become an intermittent something, like you said. It will now become something you are taking medication, but yet the symptoms persist because you have not been able to avoid the triggering factors that is causing it. Either the patient may not even be taking, some people will just be taking paracetamol on headache, fever, whatever it is, without no prescription, and it's a continuation. And there are literature to support that this drug may trigger asthma. So you need to know the kind of drugs you are taking. Is this drug compatible with somebody that have an asthma? Once you review this medication with your physician, he or she will advise you better on the environment, on the medication you need to take, and the lifestyle modification. Once these things are done, then the others is just to prescribe a drug, which mostly we call them inhalers, and some supportive medication, oral drugs. It's only when the patient now comes to the hospital, we now have to use a parenteral route to give, to now save the person, from dying, because at that point in time, he or she may not be able to take the oral drugs. So they are both oral, they are parenteral medications, and there are also aerosol drugs that we also prescribe for patients. So it's important for a qualified person to prescribe this medication to this patient who is asthmatic, and also to encourage and advise this patient on lifestyle modifications. Once these things are done, I find out that asthmatic patients can live their life without not being, afraid of the work that they're going to do. It's not going to prevent you from doing your normal routine activity. Asthmatic can work anywhere. There are some environments they may not advise you not to, if it has to do with some chemical that will irritate your airway, since you already have what we call hypersensitivity, hyper-responsiveness, hyper-secretion of this airway. So the doctor will now advise you, where do you work? When you see a doctor in the hospital telling you about someone that have an asthma, he's trying to find out whether the environment you currently work is going to be a factor in the management of this asthma. So it's a detailed discussion between the doctor and the patient, so that you don't finish, a man works in a poultry industry, and that's the source of livelihood, and he or she is asthmatic. The children come around to do the same thing. So it's important to let them know that, yes, I cannot deprive you of this work you are doing, but for your health, for you to be alive, health, they say, is what? Wet. So you need to compare, you need to see how you can come to a balance between this source of livelihood and your life. So it is a detailed information that a doctor will give a patient, and the patient will now have to keep to this, yield to this advice, so that he can live a very, very good life.
Okay, for an adult, it's so easy to follow. That's for those who want to follow the rules so that they can live good life. What about in children who cannot control themselves? How do parents manage these children?
Once you have children that are asthmatic, it's just for the mother or the parents now, the caregiver, to ensure that these children avoid the triggering factors. Because for adults, you could tell them not to do this, not to do that. But for children, yes, you make sure that they don't have, if they have a respiratory tract infection, maybe they have a cough of 2 to 3 days, they should take good antibiotics so that it doesn't now deteriorate, or worsen. The advice of a doctor. Now.
Because you're just talking now, some parents will just run to the nearest pharmacy to say, give me good antibiotics for this child's cough.
Yes, because that's our environment. Across the counter is usually the first point of call. But for one that have an asthma, you know that it's fertile. It's important to know that this is not the kind of a child that you will just buy across the counter. It's important for the mother to do a monitoring. You ensure the environment of your child, the room is clean, because the child may not be able to clean the room. The bed sheets are changed on time. Things that will predispose them to come down with asthmatic attack. You as a father or you as a mother, you try to eliminate those factors, and to ensure that these children, once they come down with asthmatic attack, it is not going to be a child's play. You are going to rush them to the hospital, because it's a medical emergency. You want to ensure that these children does not come down with that kind of attack. So for you to prevent them not coming down, it is good you play your own part by preventing these symptoms, by ensuring that the environment where they live is good enough. So you look at the environment. If you have your children in an environment where we have mentioned things that can predispose to it, you have pets at home, you have chemical industry around you, you eliminate that. A smoker, there is a beer parlor close to your house where they smoke, ensure that children does not go there. Or there's an uncle of this child who he or she come to the house at a particular time, and when he's smoking, the child, they are there. You ensure that they don't sit down where people are smoking. So the mother will not counsel if the child is the one that can, maybe from 7, you ensure that, don't go to this place, don't go to this place, see who you are. But by the time they are already 12 and above, they will also take responsibility of their own management.
Okay, now let's look at food. Are there some kind of foods that trigger asthma?
Well, people have said, there are so many literature that have said about food. Some food that you will say does not even trigger asthma may not even trigger for the other person. So it is, you cannot just be point, oh, this is the kind of food that does not trigger asthma, or these are the one that trigger asthma. But literature said that what food that contains some multivitamins, this food that contains these vitamins will prevent this patient from, like fruits generally, prevent this patient from having an asthma, or ensure that they don't come down with these symptoms. But there are no just particular food, because you could say asthmatic A taking oranges and no, there's no symptoms. Why somebody tell you, oh, whenever I do this, that's why the gene is a genetic issues now. Where I react to A, you react to B. You don't react to A, you don't react to B. It's a vice versa. So there is no just a particular food that you will take that will not make you to have an asthma, or there are food you will not take that will make you to have an asthma. But whatever an asthmatic observe, he or she may be allergic to some certain things that other persons around them are not. By the time you were able to observe and identify this particular food or environment or things, then it is important for you to know and avoid such a thing so that it doesn't now trigger your asthma.
So how is cold a triggering factor?
Cold, as you know, once somebody had cold, just very simple, the airway has not expanded. And we said asthma is a triad. The airway is hyper-responsive to any stimulus. So during cold, it's important the airway is not going to be open as compared to during the on a sunny day. So cold will trigger the asthma as a result of the mucus that are secreted in the airway and it's not being cleared. So it will lead to a situation whereby there is a congestion of the airway, and the airway is already narrow in an asthmatic patient compared to the normal one. So cold will make the airway not to allow the air to go in, and therefore make the patient to present with the symptoms of asthma.
At what point does it become so dangerous to the point of death? Because some persons you will hear, I saw this person a while ago, and they tell you the person is dead because of asthma.
You know, I said asthma is a medical emergency.
Yes.
And as a doctor, we classify asthma into mild, moderate, severe, life-threatening, depending on the symptoms the patient presents. Somebody could be asthmatic, manage to drive his or her car to the emergency room. Somebody is asthmatic, is not able to even talk, is not able to even do anything at all. He or she will be rushed by the relative. So when you observe somebody that have had a life-threatening asthma, or somebody that have been rushed into the emergency room, may likely, if he or she fails to take the drugs. So at what point it becomes now a life-threatening? When an asthmatic is now presenting maybe within a month, you know, on 2-3 attacks, becoming frequently, and a doctor have decided to raise the medication. Somebody was taking 5 milligrams of a particular drug like steroid, raise it to 20, yet the symptoms persist, raise it to 40, the symptoms persist. So at this point in time, it becomes very important for that patient to be monitored. Either the drugs are not working, either the patient is not taking adequate, the patient not taking the drugs, because some patient will collect drugs from you, use the drug money to buy their drugs, and go to their various home and not take the drugs, and dump the drugs. So once there is a frequent attack of asthma in a particular patient, it becomes very dangerous for the patient and the relative to know at any point in time. Or somebody had an asthmatic is supposed to carry, there's a drug, as one particular inhaler will say, take it along with you, wherever you are, and you take it. It's not a drug that is morning, afternoon, or evening. Just at any point in time, as many times as possible. So by the time a patient you see today and said, where is your particular drug A? He said he's at home and had an attack while I was in school. I was rushed to this so and so place. Thank God for that. Last week again I had another attack. Just yesterday I had another attack. Then it becomes a life-threatening asthma, because at that point in time, the patient could have an attack, but nothing will happen. But when you come to our hospital, we look at you, we'll look at some parameters, pulse rate, your respiratory rate, and the chest will also tell us, these features will let us know that this is a life-threatening because of what we notice on our monitor and what we can write down. But for somebody who is still talking but is not breathing well, you know, it's just a mild asthma, then we cannot control that. We also group this person as having a mild asthma. But somebody who is not able to talk, the chest is very clear, it's silent, it's not even, you can't even feel any sound, and you are using oxygen and various medications to now bring the patient back to life. That's a life-threatening asthma. Wow.
All right, doctor, let us look at managing asthma in pregnant women, because we know that at that point it is very dicey. Asthma
can determine the outcome of pregnancy. and pregnancy can also, determine the severity of asthma. It's vice versa. Patient have an asthma and he or she she's now pregnant. Once she's pregnant, it's important for the asthmatic to be controlled by both the respiratory physician and the obstetricians, because the asthma may become worse during pregnancy. But it's important to know that the same drugs that we are prescribing for the normal person who is not pregnant is the same drug the patient will now take. You understand?
So it will not affect the child?
Yes, it will not affect the child. We will now look at the child, the trimester of this child, whether it's first or second or third trimester, then place the adequate medication. But more often, it's just almost the same medications you are going to give a non-asthmatic. Maybe you now adjust the dosage of this drug, but it's the same medication you are going to use. And maybe there are other additions, maybe antibiotics and everything. So you now look at the pregnant woman, and the antibiotic is compatible with pregnancy. So you don't now give that one to the pregnant woman. Why? For the inhalers you are going to use, they are mostly going to be the same. But at this point in time, the patient will now have another counseling because of the pregnancy, so that she can take care of herself while pregnant, and also understand that this time around it's important for you to be on medication regularly because of the unborn baby. So
patients who are asthmatic should not be scared of getting pregnant
at all.
You just go ahead and do that.
Yes.
Okay, let's quickly take this call. Hello, caller. Good afternoon. Good afternoon. Hello, good afternoon. Reduce the audio level of your television set, please.
Good afternoon.
Good afternoon. I can hear you.
Okay. I was pregnant.
Okay.
Now, I breathe up.
Okay. You're pregnant. You breathe up. Or please, anytime you want to call, reduce the audio level on your television set so that we can hear you, so that the doctor can hear you and give you an answer. Do we have a call? You just said that caller didn't complete
she was
the
here,
call.
she's pregnant and she's breathing up. Many things could be responsible for that. Asthma is not the only thing that can make somebody to be breathing, to be having labor breathing. So it's important for her to present to the hospital while the doctor will examine and know whether this not breathing well is asthma or not.
Okay, so do we have another call? All right, while we're waiting for call, though time is running, but we'll do our best. You just talked about sports and other plays that can trigger, there are factors that can trigger asthma. We know children are hyperactive. How do you curb a child who is asthmatic, and especially when the parent is not there?
It does not really mean, because one is asthmatic, she cannot play. When something has happened, the most important thing to do.
Doctor, let's quickly take this call now before we lose it. Hello?
Hello?
Please reduce the audio level on your television set. All right, good afternoon. Hello? Okay, I said reduce the audio level. I didn't say move away. Hello?
Hello?
Yeah, good afternoon.
Good afternoon. I see this number for television.
Okay.
Hello?
Ask your question now.
Good afternoon. I see this number for television about asthma.
Yes. Oh yeah, ask question now.
Is that?
Ask your question.
Okay, this asthma of it, how can it leave someone alone?
How can?
If asthma can leave somebody alone.
Okay, if asthma can leave somebody.
I said whether this thing of it, can it leave someone alone?
Okay, can the asthma not leave somebody alone, doctor?
Well, I wish it's possible. We have said that asthma will leave you alone. Once somebody is diagnosed of having asthma, we say it's not curable, but it's controllable.
The network is not clear. It's not clear.
Okay, just switch off your cut the call and then listen to the doctor. Cut the call, turn on the volume on your television set and hear what the doctor is saying.
So once somebody have an asthma, it's important to go to the hospital, as we have said. Once the diagnosis is made, and the patient should follow up a clinic visit, take regular medication. Since we said it's not curable, but it's controllable, so the patient will be on medication. That's when it will not present with the symptoms, and it will not present with the sign, and it will not be an attack, and it will not make the person to be admitted by the time you do your own part of it. But once you are told you have asthma and you reject it, and all of a sudden in a particular place the symptoms now come, it may be very fatal. Okay,
let's look at first aid to asthma when one is having an attack and nobody's around, or maybe those around cannot help. Okay, before that, hello. Hello, good afternoon.
I'm sorry, no, my cat mentioned
No wahala.
I get pregnant, so I did pick up. So I can't go hospital. They can't use oxygen. They keep the breathing down. They can't say, well, I get asthma or family. I thought I don't get asthma or family. So they can't try to, they can't go do X-ray. I can't go do chest X-ray. They say my chest is pure. So nothing to do my chest. So now, anytime I cough now, the cough they disturb me well. How they get it?
Okay, you don't born now.
I don't born. I got it.
But the cough they disturb you well.
Yes, the cough they disturb me well. The cough they not they drink. I no sleep. I won't breathe. Go bless the breathe won't go home again.
Okay.
I want to have no time for 6 days.
Okay. All right, doctor.
Well, first and foremost, we thank God for her life that she has put to bed. This is even the time for you to now, like you asked before, the treatment both in pregnancy and not pregnancy, we said they are just similar. But the doctor could make some adjustment with the medication. So now you now have cough that is refusing to go. And we also said that some other symptoms, some other disease, systemic diseases, or some other respiratory diseases,
and she finds it difficult to breathe when the cough comes.
Could also worsen asthma. So what is now important for her to do, or for you to do, madam, is to go back to the hospital, let them do a chest X-ray for you, and see if it is just an asthma. And if it's asthma, they'll put her on a medication that will be able to make sure that the cough, ceases, and also rule out other things that may make that cough to be there. So all she needs to do is to go to the hospital to receive proper medical examination and treatment.
Okay, madam, I hope you heard that. Hello, caller. Good afternoon. Hello? Hello? All right, we're going to talk about what you do when you are having an attack.
Yes, that's not the time for you to, because it's a fatal disease, a medical emergency. Once one is not aware that it's an asthma, it's going to be a very big problem. Because at that time, maybe this is not breathing well, they may think that it's something that is responsible, even close the mouth. Because this patient that is not breathing well may want to use the mouth as an assistant, yes, to assist, because this airway is already blocked now. So what is important at that time is to ensure that the environment there is adequate ventilation. And every person, what will be in the mind for them to do is to ensure that they get the person to the hospital. If you listen to the woman, she said she was not breathing well, and she was rushed to the hospital, and they gave her oxygen. Why? Because they know that as one is not breathing well, what normally happens is that the lungs will not be saturated with oxygen. And once one is not saturated, then brain cannot even get it. So oxygen at that time become a necessity. That's not the time everybody will now come out from the house and crowd the same patient who is not even breathing well. And even the little oxygen that is even present, where every other person has taken it away. So it's important at that point in time for you to expose this patient and ensure it is an onward route to the hospital or to any health facilities where they can get medications that will be able to reverse this airway. The airway that is already obstructed, that can reverse this smooth airways and ensure that the patient is now able to breathe well. One of the good things about asthma is that once they come to the hospital and diagnosis is made, it's just a clinical diagnosis. Once you give them the right medication, within 10 to 15 minutes, the same man that was not breathing well now will just start breathing well because you have been able to reverse this obstruction. All
right, caller, reduce the audio level on your television set, please. Hello? Please, when you want to call, if you just have to call, reduce the audio level on your television set so that we'll be able to hear you. If you do not reduce your audio level, there is nothing we can do. Hello, caller, good afternoon. Hello? Okay, we have also lost that call. All right, doctor, one word before we go. Word of advice to those out there who are watching and finding it difficult to reach out. Hello? Hello? All right, if you do not reduce the audio level on your television set, we will not be able to take your call. All right, hello? Hello. Okay, doctor. How do we get those people out there to know that asthma is not a child's play? It's not something to joke with.
The Englishman said the problem shared is half solved. You cannot have...
Doctor, let me pause you. Hello? Hello? Okay.
You cannot have a complaint, a medical complaint, and decide to stay in your house. It is important for you to reach out for the expert who will advise you adequately. They may say you have an asthma. As soon as you come to the hospital, we have so many persons refer from a peripheral center to the teaching hospital that they are asthmatic or they have asthma. As soon as we examine them and find out that, we will just monitor them for a while and see that maybe what they have was other respiratory illnesses that they said was asthma. And we have done the necessary investigations. No one is pointing towards asthma. But also examining, no one is pointing towards asthma. So what we now do is we follow them up, and the time we let them be. So once you have any complaint that you think somebody should advise you, it is better you leave your room, enter the hospital. To obtain a card may just be what you need to do. Come to the hospital, obtain a card.
Hello, good afternoon. Okay, tell us your name. Can you reduce the audio level on your television set? Because we can't hear you. We can barely hear you. All right, doctor. Hello? If you do not reduce your audio level, you cannot talk to us. There is no way you can talk to us and want to hear yourself at the same time.
So once you have a medical illness, come to the hospital. We'll advise you, examine you, and give you the best advice.
Okay, so, well, it's like we're having difficulties making calls today because the lines are so jam-packed. And next time you want to call on the program, please do well to reduce the audio level on your television sets so that we'll be able to hear you. At this point, I want to say thank you very much, Dr. Godfrey Nodiana, for finding time to come and, school us on asthma. Now you've heard almost everything that you need to know about this illness. It is not a child's play, whether in adults or in children. Once somebody is having an attack, make way, give that person plenty of air, and make sure you are on your way to the hospital according to the doctor, so that you will be able to save that person's life. If you do not do that, you may just lose that person, okay? And it is possible to have asthma without knowing. If you do not go to the hospital, there is no way you can know. So life does not owe you health. You owe yourself health, okay? And when you're healthy, you're wealthy. We'll see you again on Monday. Until then, please, play safe. Bye-bye.